What is the most precious gift life gives us? For many, it's memory, the ability to recall moments of joy, lessons learned, and connections with loved ones. Memory is what shapes our identities, binds us to our families and friends, and carries the essence of our existence. Without it, even a long life can feel empty. In 1906, Dr. Alois Alzheimer first described a woman who had lost her grasp on time and space, forgetting almost everything about her life. This case marked the discovery of Alzheimer's disease, a condition that gradually erases a person's memory and identity. More than a century later, Alzheimer's remains one of the most feared diseases, and progress in its treatment has been slow. However, at a 2015 TED Talk, Dr. Cohen offered hope, stating that Alzheimer's is not an inevitable part of aging. He suggested that the disease could be slowed or even reversed. Coconut oil and breast milk. A surprising connection. Dr. Mary's husband was diagnosed with Alzheimer's, and she was determined to find a way to help him. She noticed that the key ingredient in Alzheimer's medication was medium-chain fatty acids, MCTs, requiring about 20 grams per dose. Interestingly, coconut oil is rich in MCTs, so she began adding it to her husband's breakfast. After 60 days of consuming coconut oil, his concentration improved significantly, and cognitive tests showed promising results. Infants get plenty of MCTs from breast milk, and many infant formulas include them to mimic breast milk's benefits. This led to an intriguing discovery. MCTs can replace glucose as an energy source for the brain, providing a potential lifeline for Alzheimer's patients whose brains struggle to metabolize glucose. The brain's energy crisis. The brain is an energy-intensive organ, accounting for only 2% of an adult's body weight but consuming 20–25% of the body's energy and oxygen. Alzheimer's patients, however, experience a significant reduction in glucose metabolism in the brain, with levels about 45% lower than those in healthy individuals. But there's a silver lining. Alzheimer's patients can use ketones, metabolites derived from body fat, as an alternative energy source. Studies have shown that ketones can meet at least 60% of the brain's energy needs, offering a potential pathway to alleviate Alzheimer's symptoms. A fresh approach to Alzheimer's prevention and management. So, if glucose metabolism is impaired in Alzheimer's patients, providing an alternative energy source like ketones might be a game-changer. Dr. George Kill's 2006 study found that infants naturally have higher ketone levels due to their reliance on breast milk, suggesting that ketones might play a role in early brain development. This realization has opened new avenues for Alzheimer's research and treatment. Moreover, Alzheimer's has been linked to insulin resistance or type 2 diabetes, often referred to as type 3 diabetes. The connection between high insulin levels and Alzheimer's underscores the need for a holistic approach to treatment. Dale Redism, an author and expert on Alzheimer's, suggests addressing 36 different factors to tackle the disease, from diet and exercise to vitamin supplements and sleep quality. Protecting our most valuable asset. Memory is a treasure we can't afford to lose. While we may not have a cure for Alzheimer's yet, there are steps we can take to prevent, control, and manage the condition. A low-carb diet, increased MCTs, regular exercise, and other lifestyle changes can make a meaningful difference. The key is to be proactive and focus on holistic health rather than relying solely on medication. Alzheimer's disease may pose significant challenges, but with innovative approaches and a comprehensive understanding of the brain's energy needs, there's hope for a brighter future, one where memory remains a cherished part of life.